good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Orko Mukherjee, with you, the IT manager. We have some sort of issues with the quiz competition, which we will talk on later at the end of the video, end of the CME. And also, we are going late with the CME show, so pardon us. We were facing some technical difficulties. So, without wasting any more time, let's just start our 30 seconds countdown time.
Hello, good evening, everybody. Good evening, Kalyani sir.
Good evening. Very good evening. Good evening.
Slowly but steadily, we are inching towards our century CME episode. Today, we are on the 94th CME. We like to inform that we will be hosting the CME, whatever be the challenges are faced. And today we face a lot of challenges thanks to our IT team and all our participants, the resource personnel. We had some issues, but we had been able to start before 8:30. We are already late by 29 minutes. And with your permission, Kalyani sir, let us call on tonight's inaugurator, Dr. Sangita Dinda. She had been a brilliant scholar, and she is our PG from National Institute of Homoeopathy. I request our IT manager, Orko Mukherjee, to bring on Dr. Sangita on screen. Good evening, Dr. Sangita.
Good evening, sir. Good evening, sir. Am I audible, sir?
You're audible.
Sure.
Okay, sir. A very good evening. I'm seeing Dr. Narayan Kalyani, sir, after a long time. It's so good to see, sir. And good evening, Dr. Bidyut Mukherjee, sir. And to all my respected seniors, teachers, and alumni of National Institute of Homeopathy, I wish a very good evening. And today's topic, the topic is on hair loss. Will be conducted by Dr. Akashbonti Sonowal. She is 19th batch BHMS from National Institute of Homeopathy. And Dr. Sandeep Mishra, sir, who is going to be the moderator for today's session. He is 5th batch UG and 2nd batch PG and presently working as consultant homeopath, Kanpur IIT. And myself, Dr. Sangita Dinda. I am homeopathic medical officer presently working under Chopra Rural Hospital in Uttar Dinajpur. Now, this topic of hair loss, it's a very burning issue nowadays, as we can see many patients coming in the outpatient department, especially young people who are very distressed due to this very common prevailing problem, which is nowadays prevailing in the young people due to a variety of causes. The variety of causes may be due to some hormonal issues, or maybe due to lifestyle disorders, or some internal problems. And as we all know, in our homeopathic parlance, we know and we have learned that any external problem is always due to some internal cause. So the treatment of that internal cause is very much necessary. And on this topic only, today we are going to throw some focus by Dr. Akashbonti Sonowal and provide a very huge sort of relief to those people who are suffering from this problem, that is hair loss. So like in my experience, I've seen in OPDs that people who are coming for hair loss, they have tried a number of treatments, basically ranging from allopathic ointments and other therapies also, but a very result is a varied type of result. But if this problem can be assessed homeopathically by providing the correct internal medicine based on the constitutional treatment, then we find that there is a lot of relief, and the number of hair loss that they used to suffer previously, that has reduced to a maximum amount. And so now, without any delay, we can go on with the session. We can carry on with the session. I would like to call upon Dr. Sandeep Kumar Mishra. Dr. Sandeep Kumar Mishra, sir. Good evening,
Yes,
sir.
good
Yes,
evening.
we had a talk in the morning, and I
Yes,
would like to invite you to act as moderator on today's session on hair loss, and please carry on with the show forward. Thank you, sir.
thank you. Good evening to all of you. Thank you for joining us today for this enlightening discussion on topic that affects many of us. Hair loss is very common these days. My name is Dr. Sandeep Kumar Mishra, and I am honored to serve as your moderator for this session. Hair loss is a common concern. We all know it can have significant impact on one's self-esteem and emotional well-being. Today, with this discussion, we'll learn a different approach, how to manage these conditions with homeopathy, what are the causes, and how it affects. We will come to know. Today we learn many new things because hair loss is a very common problem these days. It affects both mental as well as emotional level. So let's introduce our doctor, Dr. Sonowal, who is joining with us. Please welcome Dr. Sonowal.
Hello, sir. Good evening.
Hello. Good
Okay.
evening.
Yes. Today's my topic is hair loss, and I want to start now. That hair loss is also called alopecia, and today I will included in preventive measurement of hair loss and homeopathic treatment of hair loss also. First, that what is hair loss? Hair loss is it is also called alopecia. And next, what is hair? How hair is important for one's life? Uh, is represents our confidence. It represents our look, and hair is all as a aesthetic. So hair loss is a very stressful condition for nowadays patient. It is a very stressful for all patients. Like if baldness is affect their look especially. So now next I will tell about the types of hair loss. There are three main types of hair loss. First of all, that male and female pattern hair loss. Next, that alopecia areata, and the third one, telogium effluvium. And first, next we'll discuss about hair cycle, that growth of hair cycle. There are four cycles are there. First is anagen, second is catagen, third is telogen, and fourth is exogen. In anagen phase, it like 2 to 5 years lifespan of a hair is anagen phase. Here, the hair follicles hair follicles are uh, growing stage. First growing stage is called anagen phase. Next phase is catagen phase. In catagen phase, it uh, it is very short period, like 10 to 15 days period. And next is telogen phase. Telogen phase is like 2 to 4 months or 3 months. In telogen phase, the hair growing is resting phase is called resting phase. Here, that growing hair period is take rest. And next phase is exogen phase. In exogen phase, that hair falls out, and its lifespan is about 2 to 5 months. It's naturally hair falls out. These are the 4 stages of hair cycle. After hair cycle, I want to discuss about that types of hair cycle, like male pattern baldness, male pattern hair loss. What is it? In male pattern hair loss, there are severe hair fall. There are severe hair fall in male, and it have several stages. Like first stage, there are no or little hair fall, and in second stage, there are some hair fall we seen in a male, like in like forehead, between forehead and ear and forehead. This area, uh, hair fall occurs. In third stage, that hair fall, our hairline, that in male hairline recedes, recedes a little, and fourth stage, it like deep hairline receding. Then fifth stage, it is hair loss in crown area, and sixth stage is completely hair loss, complete total baldness appears. And what causes male pattern baldness? Male pattern baldness causes several factors due to several factors like age. In my experience, like 11 years experience, I feel it day by day. This age group is uh, uh, changes. Like in 2015-16, I experienced that the hair loss, this type of hair loss occurs generally in 35 to 35 and above, that patients are coming above 35 years. But nowadays, even 19 to 20 years old, uh, 20 years old also having this type of issues. This age factor, and the next factor is genetic factor. Genetic factor may be in family history, this type of pattern hair loss present, then it may occur in next generation. Then next is hormone disbalance. Hormone disbalance is in male pattern baldness. Is main hormone is testosterone, male hormone, which convert into dihydrotestosterone, and it means there is a lot of changes in the hormonal level, and the excessive androgen causes this type of issues. Uh, this is the type of this is the causes of male pattern hair loss. Next, female pattern hair loss. Female pattern hair loss is also a very common nowadays, and it also have uh, 4 stages. And in female, actually, it will seen in a partition area. Like we first of all, first stage where little or no hair fall. second stage, this partition, there will be some hair loss. And the third stage, some bald stages, bald spots appears. And in fourth stage, with bald stage, we seen hair thinning. And the causes also same like age. Normally it occurs in during menopause, but during puberty and during childbirth, uh, also it happens. Also it we can see these issues. And the next is that hormonal issues. And other causes are also there, like some stress. Maybe stress also cause this type of hair loss. And maybe some other treatment also, like some medicinal side effect also can cause this type of issues. And next, some environmental causes are also there. And these are the causes of the hair loss. Next is alopecia areata. Alopecia areata is a type of hair loss. It represents like a spot in anywhere of one's scalp. And it also seen in beard area. And it has four types, like alopecia areata, alopecia totalis, alopecia universalis, like that. And causation of alopecia areata is also it is mainly immunity related. It is an autoimmune disease. And due to immune disbalance, it causes. And next are same like stress also may occur this type of hair loss. Next, hormone, thyroid hormone also cause this type of thyroid hormone disbalance also cause this type of hair loss. And next, yes, these are the causes of alopecia areata. And the next type of hair loss is telogen effluvium. Telogen effluvium is a diffuse type of hair loss. It has no any pattern like hair loss. It may be diffuse, like it may hair loss from front area, maybe back area, maybe temporal region. It is a diffuse type of hair loss, and it causes especially due to excess of stress. These are the types of hair loss. And now I will share how we diagnose it, how will examination a hair loss patient. First is physical examination. Whenever a patient is coming for hair loss, we'll do a physical examination, like that scalp area. Scalp area, that color, maybe it is redness, maybe is it with dandruff, like that. And itchy area or what. And that hair is thinning, or how that hair shaft is there, like that. After physical examination, we'll do a pull test. In the pull test, we brush up a hair. And two or three attempts, we take some strand of hair and pull it. And we attempted 3 or 4 times. And if in it 3 to 4 times, it will be maybe one or two, or maybe more than 3, 4. then it will positive that the patient is suffering from like this type of androgenetic alopecia, like that. And after that we do a tuck test. In tuck test, just grasp a handful here, and we stretch it like an root area and tip area, and we see like any brittleness or fragility of the hair. Next, we do like a follicle test, like in follicometer, that we seen it uh, that in scalp area. In scalp area, that if it is normal scalp, then in normal scalp we consistent diameter of hair throughout, and the hair follicle containing 2 to 3 hairs in one follicle. Then in androgenetic alopecia, if we are doing follicometer test, then that one circle showing exclamation point hairs, one circle showing and there an emptiness of that area. After that, androgenetic alopecia, in case of it, that only one hair per follicle, and the diameter of hair shape is also vary. All are in different diameter. And triple CA, like the central centrifugal cicatricial alopecia. Here we seen that we seen a honeycomb network, and pinpoint white dots, and that the halos are like gray and white. After this follicometer test, that we will do that blood test especially for nutritional deficiency like iron deficiency, biotin deficiency, so we'll do biotin test or iron test. And after that hormone test, also for hormonal test, we will do a thyroid test. And in more cases, we need a uh, antamolecular test also for diagnosis of autoimmune disease. In this type, in this we just diagnosed a patient of a uh, hair loss patient, and then just we guide the patient about prevention of hair loss. That prevention of hair loss is in first in prevention of hair loss, we'll share first is nutritional support, like berries are very good for hair loss prevention, like uh, gooseberries, in that we call it amla, and any berries like strawberries, cranberries, these are very good for uh, hair. And nuts are also good for hair, so we guide a patient to take nut also, like almond, the cashew nut. These are very good supplement. Next, seeds are very good for hair. Seeds like flax seed, these are the very good resources of high protein, biotin, etc., and it is a very good for hair. and then leafy vegetables like spinach, etc. These are the food guidance. Next, we guide a patient to take proper care of hair, like for cleansing purpose. They have to do once in a week or twice in a week, have to do proper hair oiling, hair shampoo for cleansing the scalp, and hair massaging once in a week. It is a very most important for hair growth. And next and last advice is for hair loss patient or prevention of hair loss is stress free life. Being a stress free life, doing socially active activities and exercises, etc. After that, homeopathic after that I will share about homeopathic approach in hair loss. That there are so many allopathic medicines, there are so many treatments like hair transplantation, like like so many products are also there in market, but our challenge is to how to overcome this hair loss with our homeopathic treatment. In my clinical practice, I have lot of patients that they are they can get very satisfactory result with homeopathic treatment. In homeopathic treatment, we do a, a deep constitutional history. In constitutional history, we'll take the patients that all the data and their family history, their location, and their all personal histories, all are in all including here, and we are take a deep constitutional history. After that, we we also take that type of pool test, that type of duct test, and we also did a follicometer test also. And as a homeopath, we also we also have we also give them to blood test. After all this all after all we are taking this all our documents. After that, we will prescribe our homeopathic medicine. In homeopathic medicine, Thuja occidentalis, it is a very good medicine for hair loss, preventive hair loss. After that, acid floricum, then lycopodium, then sepia, then Ceonanthus americans, then acid phosphoricum. These are the in my clinical practice. I get a very good result from these medicines, and others medicines are also there, but I prescribe a lot, and I get a very good result of these medicines. And after prescribing medicine, it takes 3 to 4 months, and 3 to 4 months to get a proper result. And It may increases 6 months, it may increases 9 months, but after a proper course, one patient can get very good result, and we can receive that patient and prevent baldness of that patient. Okay, my topic is I want to end here because I'm very sorry for today because some technical issues. I can't represent my slides, and surely I will appear it in next sessions. And I want to uh, close my and I want to thankful to all of you for today's CME. Thank you.
Nicely discussed. And discussion explored several key areas. That is the understanding the hair loss. What are the common causes of hair loss from genetic predisposition to lifestyle and medical conditions? We will look at the various regions why people experience hair thinning and hair loss. Homeopathic remedies for hair loss, well explained, practical advice, and personal experience shared by Dr. Saab is really wonderful. As a wonderful session, very enlightening sessions. I learned a lot. Definitely, we should learn many things from this type of discussion. There are the many conditions why hair loss is. It is due to genetic predisposition, or due to the medicine, or due to the disease. It is due to the lifestyle or our food habits, or due to some nutritional deficiency. Nicely discussed, Dr. Saab. Thank you. In my personal experience, sir, I found China carboways these days very effective medicines for hair loss when the root cause is nutrition. When there is anemic conditions, I found carboways is a wonderful medicine for hair loss. Generally, we don't think carboways for hair loss, but these days after COVID, I learned a lot. Carboways having very wonderful results in hair fall when anemia is a cause, and there are many more medicines while when we are treating these days. Lots of medicines are there now in a humid season where the hair loss start. I found one wonderful medicine, that is magnesium carb, having very good result in this rainy season when this rainy weather comes and hair fall starts. Now sir, I want to learn something from you, sir.
Thank you, Sandeep. Beautiful session today. Many thanks to Dr. Sonowal, Dr. Dinda, and Dr. Mishra too. In details, she has presented. Our request from alumni is that you get your slides ready for the next session and try to come as early as possible with your hair loss and other subjects. Many thanks. She was hesitant a little bit, as if she is facing some examination or some board. We are brothers and sisters. These are all homely discussion. Be free and come with your experiences, whatever little it is. I don't believe that any alumni of NIS has got nothing to contribute for others. Every one of us are experiencing something. Please come forward and share it to all. Please, thank you very much, madam. Now, regarding hair loss, it is very known, well known to. I was telling in the last CME that a grand way or route is awaiting for homeopathic system of medicine, that is cosmetic homeopathy. regarding hair loss. This hair loss is a great problem for modern peoples, and day by day the number of cases are increasing. And the harassment of treatment, confirmation of treatment, homeopathy has a great field to contribute. That is our experience we have seen. To our teachers we have also seen. Loss of hair sometimes cause is not known. Majority of the cases it become idiopathic. Some cases it become definite causes. The cause is well known and clearly found in the reports that are easy for conventional system of medicine, but the idiopathic causes or the adaptive causes due to modernization, these cases are very constraints for conventional medicine, which are to us it is easier because we do not care about the etiology. We mostly care about the manifestation, symptomatology and generalities, constitution, etc. And we usually stimulate the vital force to get rid of any complaints, including hair loss. Few points I want to tell you that, especially I am telling, madam, if you are interested in hair loss, be ready and give a special time for clinic for hair losses or a cosmetic clinic, homeopathic cosmetic clinic for pimples, hair losses, discoloration, hyperpigmentation, and people, especially ladies, they are running behind this treatment. Far from he will be free from the complaints because she is looking bad. And any amount they're ready to spend just to get rid of these cosmetic complaints, including hair loss. So get ready and make a separate clinic for hair loss. Definitely will succeed. In my experience, I can tell you, for our teacher, I will tell you a few cases. From our teacher, we heard that any disease which are very fast progressing and destructive in nature, never forget to think about syphilis when other medicines are failing. And we know all of us that usually patients do not come first time to homeopaths for this type of diseases, hair loss, this and that, cosmetic complaint. They usually goes to a skin specialist. If they are fails or they are running from one to other skin specialist, ultimately they come to homeopathy. Means many drugs has been already tried by chemical doses or herbal drugs. What we do, we take the case history in details, find the individualistic symptoms, uncommon peculiars, and we select a drug to stimulate the vital force to get rid of his complaints. So in my life, I found one patient, Dr. Mr. Paswan, RB Paswan. He came to me with a complaint that gradually all the hairs of the bodies are falling out. It started from the head, then eyebrow, then beards, nostril, axilla, chest, pubic, and lower limbs. Ultimately, he becomes as if a polished person. Such a look, ugly look, completely hair loss. No eyebrow, no hairs, no hair. He came to me for recovery from Bihar. So simply by seeing his appearances, that type of very ugly looking, but energetic, very energetic, high potential youth, he is suffering from such a disease by which all type of hairs are getting falling, all getting out of the skin. It is definitely very much serious disorder. And first time I tried with civilina. First by 200, no reply. Then I stick to the medicine. I wanted to see. And repeatedly I told you, if you find that any case has become static, then wait. Wait for the next potency or next higher potency, or that potency will improve. Likewise, by giving 200, I didn't find any improvement. Patient told no improvement. But what I found surprisingly, that only 3-4 hairs on the chest is remaining, very narrow hairs. So I concentrated my mind on those hairs, whether they are falling down or they are sustained or new hairs are coming. Every time, whenever I used to come, I used to see that used to ask that you show your chest, and I see that only few hairs, 3-4 hairs, and I found that hairs are as it is without any change. I waited for a few days, no change. Then I went for 1M. In the similar manner, I started waiting and changing one after another potency. When I went up to 50 m CPLNM, I started found that very narrow, as if like cats and other hairs, very narrow, thin hairs are coming out. I was very much encouraged, and then I consoled the patient, he will be cured within a very short period. And you'll be astonished to know, whenever I get time, I'll show you the slides, that gradually the hairs come out exactly in the manner written in the 12 observation, Herring's law of cure, not 12 observation, that exactly in the reverse order of appearances. The latest loss of hair started improving and new hair started coming from there. That is legs. Then gradually, entire body, axilla, pubics, chest, hairs, eyebrows, beards mostly started coming out. Still the patient is under treatment. He has now hairs in everywhere, but very thin, ill health, immature hair. I am sure within a very short time, without giving any medicine, gradually he will improve and he will be normal. This is one case. Another case of Calcutta, one school girl was brought to me with a complaint that he is plucking out hairs while studying, while concentrating, even while he is sleeping. During sleep, he's putting his hands on the hairs and plucking unconsciously. So consciously and unconsciously plucking out his hairs to the extent she become completely hair lost, balded. Only eyebrows are remaining, looking very ugly, hairless lady. He stopped going to school. Parents are very much worried how to give him education, then marriage, etc., and was brought to me. Primarily, I tried with constitutional drugs, symptomatic drugs, but I could not conclude. Ultimately, I concentrated on one particular symptom, which is really uncommon, that plucking of hairs by one's own self is definitely painful. Then why he is plucking? Obviously, he is enjoying. The pain of plucking, he is enjoying consciously and unconsciously. Such a peculiar symptom it is. Such beautiful is homeopathy. Such fantastic is mathematics and its provings. I tried with aram triphyllum. All of you might be knowing that feels pleasure by pricking out, shedding bloods, scabs, means entertains subconsciously torture of on his own. And miraculously, this plucking started reducing day by day, and new hair started coming. Within a very short period, 5 to 6 months, she became such hairful that previously it was never like that. Means before starting of the sickness, the number of hairs, thickness of hairs, looking of the hairs become much better than before after the aram triphyllum. 1 m only one potency, and that also not frequently given. And as we have learned from Madam that Thuja fluoric acid is a fantastic drug, today we have learned a new things, carbovage. One CME we had on carbovage by one of our alumni, I can remember that CME. He was telling that repeated trauma, I remember, many of you might be remember, that repeated trauma by drugs, by different means, these repeated attacks on the disease ultimately lead to a constitution of carbovage with very scanty symptoms. You can try, as Dr. Mishra was telling, that after COVID, he have experienced many cases are getting cured of cinchona and carbovage. Cinchona by anemia and carbovage by multiple treatments. That also we can try, definitely. I have never tried, but obviously I will try with this medicine with the intention that this type of complaints that repeatedly attempted, repeatedly taken care, tried by many drugs, but failing, with a history of repeated medical trauma. Fantastic word is added. Exactly, I cannot remember his name, alumni's name. So twice I heard from Dr. Mishra that carbovage can also be a very fantastic drug for alopecia. So as like other diseases of skin disease, obviously alopecia is simply a symptom, a disease like other complaints. It is a very serious disease for cosmetic value, especially for young aged ladies and boys, but homeopathy can give fantastic relief. I can tell you one thing, and I think Dr. Mishra has experienced like that. Sonowal has also experienced. Not even a single case I have seen failed by our teachers in our OPD in NIH, by my personal experiences, not even a single case. Maybe we have to hunt for several ways. We have to retake, we have to do recase taking, we have to think for it. But I've never seen a single case who has left us without getting any improvement for alopecia. That much I can tell you. So anyway, beautiful seminar today. There are many drugs too in the repertory. We can search it out. But obviously, alopecia is a general symptom. Consideration, not a particular on the scalp or only hairs. As I told you that any serious disease or long persisting disease is ectodermal in origin. So all the ectodermal systems, that is neurological system, psychoneurology, endocrinology, skin, all are basic fundamental primary layers of your embryology. So skin disease or loss of hair is not a particular symptom at all. It is a general symptom. Take it for granted. For all the patient, you must care about the skin, not only for hair loss, but you will see in the repertory, there are a number of indications, varieties of skin disorders. Whenever you see a patient, if you read mathematics, you will see simply by seeing the hairs, consistency, thickness, color, structure, dryness or moistness, we can identify mark salt, acid nitric, lycopodium, etc. Many drugs simply by seeing the hairs. Hairs are such an important organ, or such an important indication for homeopaths as a general symptom. Usually you put it in some other way, but whenever you ask for skin, never forget to ask about the hairs. As madam was telling, from very beginning till date, what is about your hair when we ask about the skin? As we ask, what is about your skin? How is your skin? Is there any complaint? Equally, you should ask, what is about your hairs? Is there any complaint? So today's seminar is a definitely fruitful seminar, and we are more sure of it that there is no problem for us. We'll try it. Thank you very much.
Sir, Dr. Sangita is having a case. She want to share. With your permission, if you can call
Please,
Sangita.
we are waiting. Please show us.
Yes, sir. Actually, sir, in my OPD, it's a case of my OPD. The woman is about 60 years old, and she came to my treatment, and without any hair in her scalp. The main problem is with her scalp hairs. So the problem began like she used to feel itching in her scalp, and due to this itching, she used to get relief by pulling the hairs. Like Kalyani sir told, that by pulling the scalp hairs, she used to get relief from itching. And she used to pull the hairs like that, and one by one the hairs came out. And after some time, the baldness came in areata. It was like alopecia areata, and then the whole scalp was free of hair when she came to me to see. And she used to apply vermilion also, sindoor, on her scalp, which also produced some reaction, maybe due to that chemical. And doctors, when she went to the dermatologist to show, they told her to avoid using vermilion. She was a married lady. So like when she came to my OPD, then I took the case, and I found that there are some prominent mental symptoms, like the mental characteristics of when she used to get anger, and she used to keep herself shut down. She did not talk with anyone when she was angry. And also, like her anger was not shown by shouting, etc. She used to keep quiet at times, then at other times she used to weep when she was angry. And if someone came for consoling her, then it was like a very violent show of anger. And some other physical symptoms I took, and then I thought Natramure. It was like I gave her Natramure 200 only. of all, 3 doses followed by placebo. And I told her to come after 2 weeks. After 2 weeks, when she came, her itching was much reduced. I mean, basically, the primary symptom that she used to feel was itching, because of which she used to scratch her head and pull the hairs, whatever hair was left in her scalp. Very small, small hairs was there. Basically all other hairs were out, and the itching was much relieved after 2 weeks. And I followed with placebo. Now 2 times I've given medicine. When actually she had taken medicine only for 2 times, once natramune and then second placebo. And then she came back again 2 weeks after 2 weeks, and now she is well. So I'm just continuing with placebo, but her itching is quite relieved, and she is not pulling the hairs, and I'm waiting for her hairs to grow, hopefully. So this is the case that is ongoing from now. When she comes next time, I have some pictures of her. I'll give pictures, and if possible, in my next whenever I'm present in this show. Thank you, sir. This was a case under my treatment.
Please come
That's great.
frequently to encourage us with any subject.
Yes, sir. Definitely, sir.
That's great.
Definitely, sir.
You all must remember that a single case is inspiring for many people. Whatever you are having,
Yes, sir.
please share and to encourage all of us.
Yes, sir. Yes, definitely, sir.
Bidyut today.
That's great, and we are really honored to have, and we like to thank Dr. Akashbonti, because she had been under a lot of stress once she was unable to do the presentation with the laptop. She had some issues with her instrument. So we consoled her, and she had been brave enough to come forward and present. She was very panicked, and आकाश बंदी once
But
कोशिश करने वाले की कभी हार नहीं होती. तो वो कोशिश
wonderful
की और
presentation, wonderful, covering
बहुत
all the
बढ़िया
top
वो.
essential points.
Exactly.
A very
Thank
good
you.
presentation,
And
sir. A very good
that's the
presentation.
beauty.
Yes.
Yes, sir.
That's the beauty of our CME, and we are expecting Dr. Sangita to be our speaker in the upcoming few CMEs before 100. And with your
Okay.
permission, sir, let's return back to
Thank
our
you, sir.
core.
Definitely, sir. I'll try. Yes, sir.
Today.
Sure.
Thank you, Sandeep. Please come whenever. Okay. Good night to all of you.
Okay. Good night.
Good night.
Good night,
Good night.
sir. Good night, sir.
Good night, sir.
Good night, sir.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have, please to see more contents like this, just make sure to subscribe our channel. Just click on the red button, red or gray. It will show depending on your theme. Just click on it. Click on the bell icon and just press the all notification button, and you will get updates whenever we start or schedule the live CME. And coming to the topic for this IT stuffs, that is of the quiz competition, I would like to encourage everyone to take the quiz, and we are holding it until we get some 20 or 30 advices. That means 20 and 30 points of whether to continue this quiz seminar or not, means quiz competition or not. So we have the link for the quiz group, means the common discussion group. The link is given below. You can go and join over there and write your thoughts about the quiz competition part. All the links are given in description below. Do make sure to check it out. And also we have a Spotify channel where we try to, Spotify podcast channel where we try to upload the previous CM in an audio format, so as you can listen on the background basis while traveling or something. We will continue with that too. We are trying our best to make that thing again, when start that thing again, the just continuing the podcast thing again. And one more thing, there are other links for our social media pages like Facebook. Make sure to like it. and then Instagram and Twitter handle. Just go there and follow us for some updates, and also share this video with your fellow batchmates and with your fellow homeopaths, which you know from your side or from other places. Again, so with this, thank you all. Thanks for watching. We will meet you on our next CME. Until then, it's me, Orko Mukherjee, leaving out.